Well, for the past decade, we've seen from both administrations and also the White House physicians um, denial, delusion, deceit, and delay. And my bar is pretty low. Just be truthful and be transparent. What evaluation did you do, and what were the results? So that's what we should expect. The patient can say whatever they want. That's just their political rhetoric. But a physician who has a medical license that signs a piece of paper, they do not have a license for a poetic license. They need to tell the truth to the American people.
One of the things that has concerned me about the White House physician, both the current one and under the previous president, is that sometimes they list some medications that the president is taking, but not all of them. Another one is that sometimes they don't give tests to the president, perhaps because they don't want the results to be known.
Well, I think that the information, if we say it nicely, is incomplete. What they should address to an 80-year-old are the big three. Advanced age is the number one risk factor for cardiovascular disease, for cancer, and for neurodegenerative disease. So for an 80-year-old, it is not acceptable to say, here's a blood pressure, here's an EKG. They should be assessing his cardiac function, anatomic or functional. For example, we see that he walks up long stairs on Air Force One, that's commendable. Or we see that he walks across the South Lawn to the helicopter. Again, those are average fitness scores for a 80-year-old American male, about a VO2 max of 22. To actually have fitness that's above average, they should do objective testing like a treadmill, like a stress test, a cardiac imaging of the heart, the coronary arteries, the calcium score, ultrasound of the valves, and not just say normal, but they should say, here's the ejection fraction, here's the function of the four valves, and they are not even listing the different tests that he's had.
The previous president did not take any sort of cognitive test, we're told. Trump, on the other hand, often brags about acing cognitive tests. In an interview with New York Magazine back in January, he talked about a health issue his father had. Quote, at a certain age, about 86, 87, he started getting, what do they call it? Trump pointed to his forehead and looked to his press secretary for the word that escaped him. Alzheimer's, Press Secretary Caroline Leavitt said. Like an Alzheimer's thing, Trump said. Well, I don't have it, unquote. The president turns 80 next month. Is Alzheimer's something he would be genetically at risk for because of his father having it?
Well, Alzheimer's, and there's many other forms of dementia, as well as mild cognitive impairment. It's multifactorial that genetics plays a part. Also, we're learning more and more lifestyle plays a part. The screening test that he has taken, the Montreal Cognitive